new normal. It's daunting and it's hard to even know where to start. So to talk about that today and so much more, we're pleased to be joined by leaders from the barber and stylist community from all across the country. We'll be talking about the hits this critical industry has taken and what the road ahead looks like. And we'll explore the unique and really important role that you play in contributing to public health and the greater well-being of the communities where you live and work and are such good neighbors. And we hope you'll walk away today with new ideas and a sense of collaboration and support. And I guess the last thing I would say is that you're not alone. And I hope you'll leave today knowing that the foundation is here as a resource and a friend. It's an honor to be doing this work with you, and I thank you today. It's going to be a great program. Thank you.
Well, hello there. It's truly a privilege to be joining you this afternoon. My name is Dr. Cameron Webb, and I'm the Senior Policy Advisor for Equity on the White House COVID-19 response team. But long before I joined this administration on January 20th, I've served my community as an internal medicine doctor and lawyer at the University of Virginia here in Charlottesville, Virginia. And since last March, I've been working on the front lines taking care of coronavirus patients. I work actually in our COVID unit. And so I bring that lens, that perspective of really working on the ground, working in this pandemic, to the work that I do in the White House every single day. But what's interesting is that the view from the White House has been a really challenging one. We've seen the toll that this pandemic has taken on our communities. We've seen the over 600,000 people who've lost their lives, the millions of cases of COVID, the hospitalizations, the folks who continue to have long and ongoing symptoms. And we've watched the multiple times we've made progress just to see it undone with another surge in cases. And so today, in just a couple of minutes, what I want to do is just spend some time talking to you about what we're seeing and why we think barbers and stylists are really so critical to the work that we're doing moving forward. You know, as we've said since the beginning, our path through this pandemic is to make sure that we get immunity, community immunity. In fact, we need as many people in community to be protected against this virus as possible to stop the spread of this pandemic. And one of the ways that we have asked since the very beginning that people protect themselves are things like wearing masks or maintaining physical distance and keeping space. But in December, the game changed a little bit when we had the first vaccines that became available. The Pfizer vaccine was first, with the first shots going into arms on December 15th, and then the Moderna vaccine shortly thereafter. And since that time, we've had the Johnson & Johnson vaccine. We've seen the trials come out with the AstraZeneca vaccine. So there's been a lot of conversation about the role of vaccines in helping us to end this pandemic. Because if you put together, certainly the folks who've had COVID, you put together the longer immunity that you get from the vaccines, we really do have a chance to end this pandemic. The view from the White House also includes progress that we've seen since January 20th. We've seen our case rates drop by almost 90%. We've seen deaths way down, hospitalizations way down. That's a critical improvement. And we've seen the kind of progress that's enabled us to begin to hope again, begin to hope that we're going to get closer and closer to normal. And that's why President Biden announced that by July 4th, we wanted at least 70% of adults with at least one shot in their arm by the 4th of July. And if we did that, we would be on our path to having a more normal summer. And what you all have done in communities all over the country, in a lot of instances, has exceeded even those expectations. We've seen so much progress in the vaccination effort. Now, at this point, we've got about 180 million individuals in this country who've had at least one shot of this vaccine. That's about 88% of seniors here in the United States, which is really incredible. That's about 2/3 of adults, folks over the age of 18, 66%. That makes such a huge difference when you have those levels of immunity. But one thing that we keep in mind is that the impact of the vaccines are not being felt equally all over the country. In fact, some communities have really high vaccination rates, but others, those rates are still a little bit lower. Really quickly, I'll tell you a story from my own community here in Charlottesville. You see, I got my first shot of the Pfizer vaccine on December 17th. And a couple days later, just in time for Christmas, I decided to go to my barber to get a haircut. And he said, you got a hair, or you got your first dose of your vaccine. How is that going? How are you doing? I told him I was feeling just fine, didn't have any symptoms from it, and things were going well. At that time, he was uncertain if he was going to get vaccinated or not. A few weeks later, I went back for another haircut and talked about how I was still doing just fine and got my second dose of the vaccine. Shortly thereafter, he told me he actually saw his grandmother get vaccinated and was encouraging other folks in the community to get vaccinated as well. My barber became a hub. Who were hosting vaccination sites would reach out to him to spread the word through his Facebook, through his Twitter, through different spaces, so they knew where they could get vaccinated. He got vaccinated himself, in fact. And then most recently, just last month, he hosted a vaccination event at the barbershop. Yes, he was delivering shots at the shop. And the reason was, he said it's a natural space for folks to have these conversations, a natural space where people trust, and he just wanted to do his part to getting things back to normal. Barbers and stylists were hit really hard by this pandemic, having to close down for some time, and he wanted to do whatever he could to keep things moving forward. We saw that from the White House. We saw the great work that Dr. Stephen Thomas was doing in Maryland, that folks were doing in Chicago and in New York City and really all over the country, Cleveland, Milwaukee. And we said, this is a model. This is a way for us to move forward. And so it was really exciting to see this come together. That's why we launched the Shots at the Shop initiative. The president announced on June 2nd. And so far, over 800 shops have signed up to be a part of this, to share vaccine information, do some education, and even administer some vaccines in their shops. So I just want to say thank you so much for being a part of this response and a part of this effort, for helping us get things closer to normal. But you are really going to be one of the keys to making sure that nobody is left behind. You are so critical in all of our communities to be those voices, those trusted messengers, those trusted persons, the places where people come together and feel like they can be themselves. So thank you for the work that you do and that you'll continue to do as we move forward.
Welcome to Shots at the Shop, and today we're at Katrina's Trey Shades Hair Studio in Capitol Heights, Maryland, which has been amazing.
My favorite part is saving lives, seeing people get vaccinated, because a lot of people are hesitant to get vaccinated. So if I can advocate and encourage them, I'm excited to do so.
A lot of people just don't trust the system. So we have to take the time to answer their questions. And what better place to do that than in a place they already trust?
They can dispel some myths and misinformation that's out there, and then they can refer them to others with, more specific questions.
I've honestly seen about 25 to 30 of my clients go from, no, I'm not getting that vaccine, to sure, I'll get vaccinated or show up at your clinic on Monday.
I got my vaccination.
Well, I was comfortable with coming here. I actually feel comfortable here than I would at a normal clinic.
I like it because I know this place is not like it's not strange or anything.
You truly are, Barbers and Stylists, a trusted voice in the community, and we want to tap into your expertise and be a good community partner.
It's just for us to be knowledgeable in these health disparities so that we can have conversations behind our chair, because I believe that we're more than just a hairstylist. We're touching people just like doctors and nurses do.
Any barbershop that wants to hold a vaccine clinic in their place of business will find you a clinical partner.
So we can bring in all the clinical expertise.
I say just do it. Just work on saving lives. Keep advocating for the community, bringing more people in. And I do believe that having a vaccine clinic at a salon is well worth it.
It worked here at Trey Shades, and it could work in your barbershop or beauty salon as well.
Yes, son, you're fully vaccinated. It was a great day.
Hello, my name is Dr. Stephen B. Thomas. I am so excited to be here with you today, and for you to have an opportunity to have met Katrina in one of our shops right here inside the Capitol Beltway, probably 8 miles from the White House, where we held a vaccine clinic for parents and their kids. And you know what makes me so happy? That we're taking something so humble as the barbershop and beauty salon and bringing it from the margins into the mainstream. We're about saving lives. And I'm so excited to introduce this audience to some of the leaders around the country. And I'm going to ask them to think for a moment, think about a word right now that best characterizes how you're feeling at this moment in this pandemic. And when you introduce yourself, share that word with us. So let's begin with Mary Comines. Mary, how you doing today?
I'm doing great, Dr. Thomas. Thank you for having me.
What's your word? What's your word, my sister?
My word is opportunity. The pandemic hit us all really hard, but we had to look at the healthy outcome. And all I can see with the help of my husband, who has the healthiest outlook than anybody I ever know, is I see the opportunity how we can connect with our fellow hairdressers, hairstylists, and barbers, and then how we can connect with our salon guests to just see the light, not only at the end of the tunnel, but also going through the tunnel. So opportunity is it for me.
Oh, you know what? Did you see that clinical partner's name, Luminous Health? You're right. We took that light at the end of the tunnel and we brought it into the community. That's what we need to do. Hey, Roderick, how you doing down there, brother?
Hey, I'm well, sir. Thank you so much. My name is Rodrick Samuels. I'm the Director of Education here in Detroit, Michigan, at Hair Lab Detroit Barber School. And I think my top word for the pandemic is definitely relentless. I think that as barbers and stylists, we really got out of our comfort zone. And I think that even though, there were some ebbs and flows that actually happened, I think it took our industry from being good to great, and then from being great to now becoming unstoppable.
I love that. And Roderick, every now and then I have to tell my white brothers and sisters, no self-respecting black barber ever said get you in and out in 15 minutes, no matter how much hair you have, right?
that is true. That is true. This is actually probably the hardest haircut in the world to do. So.
You got that right. Hey, my brother Carlos, how you doing, my man?
Thank you very much, Dr. Thomas. I'm doing very well. I'm Carlos Valenzuela, and I've been everything in the industry for the last 47 years. I'm very happy to be here. And my word is love. That's what my word is for this moment, because it's a love for yourself by getting the vaccine and beginning a clinic. It's a love for those you love to protect. It's a love for all your clients, and it's a love for your business that motivates you and moves you to keep going and do the right thing with this campaign.
Well, thank you so very much. We don't have a lot of time, but this is the heart and soul, I believe, of this whole meeting here. And let me thank the Chamber and Barbicide and Blacks Against COVID for making this possible, and the White House for bringing us to the front lines of the battle to save our communities. You can't do what you do 6 feet away. Am I right? So
No.
How do we make sure that barbershops and salons are safe places as we move forward? So one of the things I want you to think about is the fact that we have people out there who are watchful waiters. I'm waiting. I don't want to be first. Think about those people. I want you to speak to them in a moment. And then we have the cost conscious. We say the vaccine's free, but can you get off work? Do you have transportation? Then there are the system distrusters. You don't have to go all the way back to Tuskegee to know why people distrust. It may be an uncle or auntie who was treated disrespectfully, and they remember that. And that other group, the COVID skeptics, they're at the hell no wall. They're saying hell no, and they don't even have a reason. Do you know people in those categories? Have I missed anyone? What do we say to them, Mary? What do we say to those who have these attitudes and beliefs right now?
Well, for me, I think I don't like to spend so much time with the naysayers. I feel like if we spend the time with the people who are on board with you and moving forward in the direction that you want to go and are on board with getting a vaccine and being part of the community help. The more of those people that we can communicate with and get on our bus, I think that those people will spread the love, spread the knowledge, and we'll come out on top, because then it'll be more people getting the vaccine, more people going with it, more people spreading the word. And then the people who are the naysayers, the freeloaders, those become less and less, because sometimes you can talk till you're blue in the face and not get anywhere with those people. And you leave behind the people that want to get on board with you. So I try to get on board, get the people, like surround myself with the right people like yourselves that are, we're going to get on the bus and we're going to all go down the same path together. We're stronger together. So I try to put my focus that way.
Okay, I think that's excellent. And we started out in the beginning how we're all in this together. We're all in the same storm. Remember that? But we're in different boats.
We are.
Some people are in inner tubes, Roderick. Some people floating out there all by themselves. From your vantage point, from what you see in the classroom, from what you see and hear people saying in the chair, what are you hearing and how do we respond?
You know what, Dr. Thomas, three things actually come to mind for me. So the first thing is, it's not about who's right, it's about what's right. And when you are in the service industry, you're servicing people on a daily basis. So for me, it actually makes sense to go ahead and get vaccinated so that you don't continue to spread this to any of your other clients. The second thing that comes to mind is, it's about shaping heads and shaping lives. So not only do we have an opportunity to do amazing hairstyles and to make people feel good, we also now have an opportunity to keep our students healthy, our clients healthy, but also, the foundation of every small business is the community. So it's not selling out if you decide to get the vaccine. It's actually called buying in. And I think that as barbers and stylists, not only do we have an opportunity to shape lives, we also have an opportunity to shape hair, but also how people look at our industry and some of the opportunities that we have to make our community stronger and to get healthier and better together.
I hope the audience heard what you said, Roderick. You put a little subtext in there, selling out. What they need to know is that in the Black community, you could be perceived as a sellout, perceived as a Uncle Tom, perceived as a traitor against your own community, and we cannot put them in that situation. I love what you said. It is not selling out, it's buying in.
Correct.
Now, Carlos, my Latino brothers and sisters, we all in the same boat. We sometimes get hit by the same kinds of things, and yet there are differences. What are you hearing, and how are you responding?
Well, I think what the Latino community, and I cannot speak for all of them, but with the Latino community, how it basically works is a lot by hearsay. We communicate with each other and we hear that someone said so-and-so about the vaccine and so on. So I think I definitely agree with what Mary said. I think it's an opportunity. It's an opportunity for us to get out there and build momentum, because that's what Latinos need. Once they see people going to a beauty salon and having a health professional be there and getting the vaccine, where they also get their hair done and eat cookies and hang out, I think it's going to build and build and build. And I have anything I would need to say to my Latino brothers and sisters, a little tiny spiel in Spanish. It will go something like this: compadre, comadrita, vamos a vacunarnos por el bien de tu salud, la salud de tus seres queridos y la salud de tu negocio. Vamos.
My friend, even though I didn't understand the Spanish, I understood the spirit in which it was delivered. I think we need more acts of kindness. Now, realize this: 600,000 people dead from this disease, okay? So when people talk about the side effects of the vaccine, a little sore arm, nothing like getting this disease. It's likely someone will sit in your chairs who's been touched by this. Talk to us about how you can deal with the issues around grief, or even some of the mental health issues that people might be dealing with that might make them hesitant to get vaccinated. Who wants to start with that? Hillary, jump right in there. Hillary, I'm looking at you. I'm looking at you, Mary, and saying Hillary.
That's okay. You can call me Hillary. I was like, oh, where's she at? Well, it's crazy because as hairdressers and barbers, the community, when something good happens, when something bad happens, when they're happy or they're sad, the first thing that our wonderful loyal guests usually think to do is, I got to go to the salon. And we're more than just their hairdresser. We're kind of like their therapist with the word hair in there. And our responsibility, whether they're talking about their hair or life circumstances, is to listen more than we speak. So oftentimes I just try to take a deep breath. I let them talk. I listen to them. We, offer them any solutions of pointing them in the direction to seeing a professional in the mental health capacity if that's what they truly need. But oftentimes what I've noticed in the salon over this last year and a half, after closing 3 times, and our guests really they really wanted to come to us to get that relief, to be able to say what they wanted to say without being judged, get everything off of their chest, and for us to listen and make them look and feel their very best. Because the second the power of touch, I don't think the world realizes the power of touch. And we have the ability, unlike pretty much any other industry besides doctors, to touch our guests. And when you put your hand on them, that caring hand, and you wash their hair or hot towel in the barber shop, I mean, it's transformative, and it really can take somebody to another place. But, we have to listen without judgment. It's our responsibility. We have to lead through example. Again, back to, making sure that we can say, I'm proud that my team is all vaccinated. So, we have to be there for them, because they do turn to us, and they know that chair is that confidential space where there's no judgment. And we just want to take care of them and make them look and feel their very best and get them back up on their feet to, take on the rest of the world and, start living life after the pandemic.
Well, Mary, I'm going to take that as your take-home message to this audience. And it truly is about healing. And you heard Katrina say, we're more than just stylists. We touch people like doctors and nurses, and you absolutely do. So can you believe how time has flown? That was Hillary's take-home message. That's what she wants people to remember.
Mary.
We're going to give Hillary a new hairstyle.
Hillary, I know. I'm going to make Hillary's hair pink for her. It doesn't matter. Keep going. This conversation's too good. So
you are so funny. And my apologies, but it is the spirit. Roderick, what's the take-home message you want the barbers and brothers out there to know when it comes to this?
I think the take-home message is, to be the best, you must stand a test for hard work, and only hard work pays off. I think that in our communities as barbers and stylists, we need to really, really, push the envelope and work hard into getting people vaccinated, getting people the education that they need, getting people, to not buy into the misinformation that's out there on the web. But, most importantly, just lending a shoulder and an ear. I think that empathy is definitely the word that we need to use moving forward, but not just talking about it, but being about it too.
I have no doubt this is going to work, and your audience needs to know that with the help of Shea Moisture, they have put forward $1 million to help recruit 1,000 barbershops across the country to provide them with a mini grant, a $1,000 mini grant to go through training. And Mary, I want you to know, we're not asking the barbers or the stylists to give the injection. It will be medical professionals coming in. So don't let people fool you. There will be people out there trying to make this confusing. We bring you the medical professionals into your shop. Yes. Carlos, what's the take-home message, my brother?
I'm totally excited. Besides vaccinated, I'm totally excited. I mean, the fact that a salon could actually tap into some money and also become a hub of activity through vaccinations by health professionals. I mean, everybody jump on it. Vámonos.
So imagine this. Yes, it took a pandemic, but at the end of the day, a new home for healthcare has a barbershop and a salon story, okay? A barbershop and a salon story. Thank you so very, very much for your time. This is a beginning, not an end. And for the audience out there, all the details will be in the posting by the Chamber. Thank you, Chamber, for making this possible.
Thank you very
Bye-bye.
much.
Thank you, everybody.
Hi, everyone. Thank you so much to the United States Chamber of Commerce Foundation and, of course, Barbicide for having us today. We're in our salon in Los Angeles, and we are just so thrilled to be a part of this because we truly believe that you as beauty professionals and beauty entrepreneurs are the backbone of every single community around the country. And I'm Ted Gibson.
And my name is Jason Bakke. We are the co-founders of Starring the Salon on La Brea here in Los Angeles, the world's first smart salon, that by divine guidance, I would say, was automatically built out to be a COVID-safe space. So we've learned a lot about how we as small business owners can really help to give a message to our community that salons, barbershops, spas, we are safe places to be, to have services provided, and to really move forward into this next phase of living in the new normal. Today's a very exciting day for us, not only because we truly feel acknowledged and recognized by the U.S. Chamber of Commerce Foundation and the White House and all of the brands, Barbicide, the other brands that have helped come together to make this event happen, that we are recognized for our worth and for our value and the things that we really contribute to our communities. We are job creators. We are the backbone of small communities, large communities. And like Mary said before, you know, people come to us and trust us with just about everything. So we are the people who really can communicate a message effectively and communicate a message with confidence and courage that is going to allow our clients, our community members, our family members to feel safe and secure and confident and go out and get those vaccines. The other reason that today is a very exciting day is we have launched our brand new website for the Worth Up Alliance. The Worth Up Alliance is actually born from the COVID-19 pandemic. When the pandemic first began, I'm sure all of you that are salon owners, barbershop owners, people working behind the chair had similar experiences to us where all of a sudden the world stopped overnight and we didn't know what to do. We didn't know where to go. We didn't know how to navigate this situation. And Ted and I sat down and had a conversation with a bunch of different friends about a positive message that we could send to our industry. And that's where Worth Up was born. That's where we're asking ourselves, we're asking you to step up, to share the information, the experience, your expertise, everything that you have with the rest of our industry. And today on the worthupalliance.org website, we're launching the Entrepreneurial Video Library, where we have assembled some of the greatest icons, the greatest leaders, the greatest product developers, the greatest of our business to share with you their wins, their failures, what they would have done differently, what they're so grateful for what they did right the first try, so that you can learn from them and be prepared to open up your own business. And that's, I think, the root of what the Chamber is all about, is really supporting individuals like us who have the courage and the confidence to step up, open our own businesses, be involved in our communities, and be able to send positive messaging to everyone, from being healthcare advocates in our communities to excellent service providers to charitable people as well.
You know, as Jason just said that, you know, I have been a longtime educator throughout every aspect of the beauty business. I've been a beauty school teacher. I have educated in classrooms. I have done just about every single trade show you can imagine around the US. And, you know, for those of you who are new to the beauty business, you know how mentorship is so valuable and so important, and how mentors, I can tell you mine. I have had probably about 4 or 5 of them, but I'll tell you my 2 most important mentors, of course, my parents, but also Horst Reckelbacher. If you didn't know, he was the founder of Aveda. back in the day. He mentored me to understand what it meant to create a brand. He taught me how to dress hair. He taught me how to be in the business of beauty. And then my other mentor that I want to give a shout out to, her name is Zan Ray. And Zan is the first person that I worked for when I was like 23 years old to become a hairdresser. She taught me how to cut hair. She taught me the importance of giving great service. And she also taught me the importance of giving a great shampoo. And without that mentorship of being able to create what I wanted to create, I wouldn't have been able to make it. And the reason why I say mentorship is so important, if you go to the worthupalliance.org and want to be, if you ever thought about being a mentor, you can actually be a mentor for Worth Up, because we're looking for people who have experience. We're looking for people that want to share their knowledge. We want to have people that really want to hold the next generation of hairdressers, barbers, estheticians, nail techs, hairstylists, future salon owners, future product developers. We want to hold them accountable. We know that we would like to have, when we opened our first salon on Fifth Avenue in New York City, would like to have called someone to say, you know, how do we do this? But we didn't feel like we were able to do that. So just so that you know, this is the perfect opportunity for those of you who are beauty entrepreneurs and want to take your career to the next level, is to be a part of the Worth Up Alliance mentorship.
We also are looking for donations, because the third step in the process for the Worth Up Alliance, number one, is education. Teaching hairdressers, barbers, spa techs, nail techs, how to have the courage and confidence to open up their business. The second challenge that we've addressed is mentorship. And then the third is we will be giving away what we're calling Dream Capital starting in the beginning of 2022. Like, what year is it? What time warp are we in? At the beginning of 2022, we're going to be giving away Dream Capital to new entrepreneurs, because we know that there is a huge inequity in funding, and we are going to be doing our part through the Worth Up Alliance to really address that inequity and make cash available for free to people who want to open up their own business. So by going to the worthupalliance.org, you can make a one-time donation, you can become a sponsor of the organization, you can become a mentor in the organization, or you can become a mentee, if you will, in the organization by donating through a monthly subscription to the Entrepreneurial Video Library. It's $9.99 a month. You have unlimited access to hear these incredible stories, and all of you that were on the panel discussion, I'm going to be hitting you up to interview you for the Worth Up Alliance Entrepreneurial Video Library. And take advantage of all of this remarkable information that the Worth Up Alliance has to share with you as beauty entrepreneurs and would-be beauty entrepreneurs.
It's so exciting. So again, go to theworthupalliance.org and get involved. Help us help the next generation of beauty entrepreneurs live their dreams. Again, we just want to say thank you very, very much to the United States Chamber of Commerce for having us. We love the beauty business. We've been in the beauty business for a very, very long time. And Barbicide, you know how I feel about you. So thank you very, very, very much.
Thank you, everyone. Have a great day.
Love you guys. And take a breath. There's a lot of information.
A lot of information.
Hello, everybody. My name is Sam TAUSSIG. I'm the head of special projects and policy at Cabbage, which is an American Express company. And today I'm here to give a small business health update. So Cabbage is a cash flow platform for small businesses. We offer payments and checking, lending products and invoicing, many more to come. But we stay very close to our customers with data and technology. And in our opinion, it's never been a better time to shop small. You know, our favorite small businesses are depending on our support, especially local establishments that make us look and feel our best. So at Cabbage, we understand how small businesses are recovering, especially how the largest are faring compared to the smallest. We launched the Cabbage Small Business Recovery Report to learn how businesses are reopening, how their revenues and sales are trending, and generally to understand the state of the market as we climb out of this pandemic. So we went and polled the smallest of small businesses, those with fewer than 20 employees, which is about half of all our respondents, medium-sized businesses with 21 to 100 employees, about a third of the respondents, and the largest small businesses with about 100 to 500 employees, and that measured in about 18% of our respondents. Our latest survey showed that 85% of small businesses are fully open for business, which is fantastic. And the results also showed a higher increase of in-person activity correlated to local vaccination rates, which is also incredible. But we're still seeing some of the smallest of the small businesses, about 15% in our survey, closed and struggling the most. Now, we've dug a little bit deeper into the salon and spa area, and we found that there's a ton of pent-up demand in the United States for all sorts of salon-based care and products, specifically over the next 6-month time horizon. About half of all adults agree that they have an obligation to help support their local salons, those that they have a really deep connection to. And I understand that too. I recently went back, and I'm going to keep my long hair if you can't tell. And I went and got that done, and I'm really happy about that. And so when we drilled in a little deeper, we did find that a third of our female respondents in the customer segment that we measured with American Express are planning on getting mani-pedis quite a bit in the next couple of months. And honestly, I think I should get a mani myself. I think it's time we all treat ourselves. I've had a rough year, and I'm sure you have too. So going back to the small business owners in the audience here, what can we do to prepare for this upcoming demand? These are good problems to have. Well, shopping small means being safe and in person. So across all of our small business respondents, about 70% agreed that vaccinations for all is essential to their recovery. And the data supports this. The volume of in-person transactions amongst vaccinated business owners increased 18% relative to business owners that were not vaccinated. That's an incredible statistic there. But we also need to make this recovery stick. So how do we hold this in place? Well, we asked our respondents how they're measuring their own recovery. And that's really important. Everybody has their own metrics for success. Well, the top responses were when they could pay their employees full wages without any concern, and when customer traffic returned to normal pre-pandemic levels, but even better, starts to exceed pre-pandemic levels. We want to keep moving. So how are these folks doing? Well, nearly 2/3 of all the small businesses stated that they're now paying their employees full wages without concern, and more than half reported that customer demand is stabilizing. Traffic is still coming though, and it's really important we're all working together to get that back to normal. But being successful also means paying yourself. And while intrinsically tied to revenue, we see that small businesses hold the well-being of their employees higher often than their own personal incomes. And we see that all the time with our customers. They love their employees and they love their community. So shifting to the future with this in mind, we ask the small businesses to forecast their future revenue and growth expectations. Well, next month versus last month, the average increase is about a 21% climb in revenue expectations, and that's a really good sign. We're really happy to see that trend data. But when we drilled in a little bit to the really small businesses, we found that that's not always the case. And we know our salon owners are often really small businesses, but important small businesses in the community. So the smallest companies are only forecasting a 13% month-over-month increase in revenue. So there's a lot of work to do on Main Street and on Pennsylvania Avenue to make sure that our smallest entrepreneurs are feeling strong and sturdy in the recovery, and that we make folks, the consumers, feel safe again. So let's look at kind of what we do here with Cabbage and American Express. You know, we're really trying to help small businesses digitize. And so we asked, how are small businesses embracing some of the new digital tools throughout the pandemic? Well, about a third of our surveyed respondents said that they plan to expand their digital operations or supplement them to replace traditional in-person methods. And this is mostly done on pen and paper. So we dug in a little bit and said, okay, well, what does that mean for salon owners and hair care specialists and you know, wherever else you get your kind of general feel-good treatment? And you obviously can't get a digital haircut. I've tried. It didn't work well. YouTube does not suffice for cutting your own hair. But 77% of our small businesses agreed that now, more than ever, they're willing to replace some of their old digital systems and technologies and adopt new technologies to run more efficiently. That's everything from digital payments and banking to mobile bookings, different types of marketing and coupons, as well as CRM tools, which is really important. You have to remind your customers that you're open, that you're ready for business, and, you know, depending on your clientele, what kind of health precautions you're taking to make sure that they feel safe and comfortable in the community. So I'm really glad I could join everybody here today and provide a little bit of a data lens on how the recovery is going. We're very confident small businesses are climbing out of this, and we're really, really confident, again, when we look at our consumer trend and demand data, that Americans are ready to go back out and get themselves cared for, because it is time. As we come back to the office, it really is time to look your best. And you know what? This is an amazing opportunity to reinvent yourself, your image, your feel, your look. But I want to leave you today with some parting words of wisdom from a real small business customer, because I just simply can't do it justice. So there's a customer, Christine Arakel at the Park's Finest in Los Angeles, and I'll leave you with this today. To be able to maintain a small business is a chance to create a safe space for our community, as well as the environment for meaningful employment. We hope our community understands the value of their spending and how it can be integral in sustaining mom and pop shops. Conscious spending within the community can contribute to neighborhood sustainability. I really could not have said it better. So thank you, Christine at the Park's Finest. And thank you all today for your time. It's been an absolute pleasure.
Good afternoon. My name is Dr. Maya CLARK-CUTAIA, and I'm an assistant professor at New York University, Rory Myers College of Nursing, and Grossman School of Medicine. I'm a nurse practitioner and a health equity researcher. I thank you for the opportunity to dialogue with you today about health disparities in populations of color and share my knowledge on the topic of COVID-19, particularly its disproportionate impact on minority and vulnerable populations across the United States. Individuals suffering from underlying medical conditions, in particular those with multiple chronic conditions such as health disease, obesity, and kidney disease, are at increased risk of a COVID-19 diagnosis and COVID-related mortality. According to the Centers for Disease Control, 78% of COVID-positive patients that were admitted to the ICU in the United States during the height of the pandemic had one or more underlying health condition. These individuals are often from vulnerable and minority populations. They are people of color, the elderly, the immunocompromised, the institutionalized, and the disenfranchised. But I am not telling you anything you do not already know. This is the population of patients I provide care to and conduct research with. It is also the population of people that you may serve. And if you are at all like me, you may see this reflected back at you in your families, your households, and your genetics. Many of my patients are from minority backgrounds. They may live in low socioeconomic status neighborhoods, and they may have low health literacy. They are the patients with diabetes and hypertension. They are often federally subsidized, living on federally subsidized programs, already making decisions regarding their health versus their basic necessities. As such, they are likely to have poorly controlled medical conditions. These are the patients that live in the underserved communities and receive care in under-resourced healthcare facilities. My patients could also come from nursing homes. However, they could just as easily be in a prison or a jail because the risks and health disparities for these populations are the same. The advent of COVID-19 has not only highlighted existing disparities and inequities, it has reminded us of the significantly poor outcomes related to lack of resources in these communities. As the COVID-19 illness emphasizes disparities in the incidence and prevalence of underlying medical conditions and treatment regimens in these vulnerable populations, it has forced us to take stock of how the current provision and division of healthcare resources in our country contributes to healthcare inequities. Forget the many advantages afforded to those of means, such as testing and homeopathic remedies that may or may not work. The sheer way of life of many in our communities puts them at risk for serious illness and difficulty adhering to recommended restrictions and management plans. For example, they have to go to work to make money, and they are less likely to seek medical care and more likely to rely on social networks like their barbershops, beauty shops, their churches for support. They are the commuter nation, sometimes taking multiple buses to and from work daily or to see me in the clinic. They are the patients who have less ability to tune into CNN, Fox, or MSNBC, and to search the web or other news outlets to stay informed of the COVID-19 crisis. For those that are institutionalized in nursing homes or prisons, those who live in tight quarters, they do not have the ability for physical distancing. Furthermore, much needed resources such as medical staff and supplies are limited, and some institutions, depending on location, geography, and funding, for example, are under-resourced. To date, about half of the people in the United States have received their first COVID vaccination. 46% of Americans have gotten a second dose and are considered fully vaccinated. The average number of new cases has decreased and continues to decrease daily as a result of this, physical distancing, increased testing, and mask wearing. Hospitalizations have also decreased, but we remain vigilant as new variants surface. Many of us would like to assign blame. We would like to prosecute the perpetrator, but the fact of the matter is, these disparities have existed long before COVID-19 and will sadly most likely persist after this pandemic. This is not to say that I feel that tackling disparities and inequities is hopeless, but that it's time to channel our outrage into action, action that is sustainable and action that is meaningful. We as providers and researchers need to be innovative in the ways that we reach our patients and ensure that they have the resources they need to keep themselves healthy and reduce their risk of contracting COVID-19 and other chronic conditions. This includes eating and sleeping well, exercising, taking their medications on time, and adhering to treatment schedules, like dialysis regimens. We need to ask ourselves difficult questions such as, how are these patients obtaining their medications from the pharmacy? How are those who suffer from kidney disease being transferred safely to and from dialysis when they're already immunocompromised? How are we reducing their risk when the suggested personal protective equipment is already worn and patients still suffer from line infections and PPP is at a premium? How are patients consuming the recommended diet when the general population continues to stock up during periods of restriction? What food remains on the shelves that is SNAP and WIC approved? How do we get exercise in neighborhoods that it's not safe to walk? How do you get enough sleep when the burden of living paycheck to paycheck weighs heavily upon your chest? And then we need to come up with creative solutions. And this is where I see you coming in. The relationship between the community and the beauty and barbershops and salons is a unique one, and one that has been leveraged in the past to reduce risk through education and access to care. If it is at all possible, we need to make this the norm. Providers want and need to educate patients and identify at-risk and vulnerable populations, as well as their potential needs and how to address them. And we need to help make that happen. Reach out to healthcare professional programs at your local universities and colleges. Get to know the health equity researchers in your area, or better yet, learn what it is the community wants and needs, and find one of us to partner with to deliver it to your community through your shops, through your salons, provided you are willing to share. It is paramount that we facilitate rapport between communities with resources and those communities that are without. Policymakers need to broaden the scope of federally subsidized programs. We are trying to urge them to begin to incentivize healthcare professionals to work in these under-resourced areas and institutions. While such programs have existed for rural areas, there are many areas in which underserved and vulnerable populations still require attention. We need to gain a better understanding of the facilitators of the disparities in our nursing homes and the prison systems, and develop realistic solutions to bring resources into these facilities. We also need pharmaceutical companies, pharmacies, and health systems to provide medications to patients free of charge, and to potentially ensure that prescription refills are delivered to those in need. Your role here is to learn about the politician, the movers and the shakers in your communities. Have them come to speak to your clientele and help us build an army of educated voters. Local politicians can encourage safe practices to keep their constituents healthy, like crowd control and safe distancing. They can keep your clientele healthy. We need to demand that the same thing happens in jails and prisons, and institute early release programs and create optimal management conditions where necessary. If we fail now to protect our communities in this way, each of us will be impacted by the loss of our loved ones to these illnesses. Again, I thank you for the opportunity today, and I welcome any additional comments or questions from the attendees. I see a question here about addressing vaccine hesitancy. This is an area of research that I'm currently working in. One of the things that we have really been focusing on is trying to understand what it is in this area that patients, and particularly vulnerable populations, are concerned about. A lot of it is related to mistrust, which is warranted, and so we're trying to aim at those areas of mistrust. The second concern is, of course, fake news. There's been a lot of false advertisement. There's been a lot of information that's come out a little bit too early that we don't really understand regarding the vaccine and side effects of the vaccine. And so we're trying to make sure that we use avenues such as social media, community organizers, community organizations to really speak some truth and get our neighborhoods and our communities informed. I see one more question about herd immunity. To make progress in regards to herd immunity, it's the same conversation I was just having previously about vaccine hesitancy. If we can get people to feel a little bit more comfortable about what the vaccine is doing, and they also understand that it's not only protecting them, but it's protecting their communities, people are more likely to do it. The more people that we have do it, the better the outcomes. I don't think we've done a very good job of advertising the benefits of the COVID vaccine and how much it's improved our outcomes even in our local areas. And so we need to do a better job of that, and really spending less time discussing, the politics of it, and more time discussing the benefits of it.
Hello, and thank you for sharing some of your valuable time with us today to participate in this important conversation about the role of barbers and stylists and other beauty providers in the fight against COVID-19. On behalf of the entire Chamber Foundation team, we'd like to thank our guests and our friends at Barbicide for making this such a powerful program. Dr. Thomas asked his panelists to think about a word that best characterizes how they're feeling at this moment in the pandemic. My word: optimistic. Why am I optimistic? I'm optimistic because of you. As you just heard, you can make a big difference in our efforts to save lives and livelihoods. Stylists, barbers, nail techs, estheticians are among those who paid a heavy price during the earliest days of the pandemic. And it's thanks to the rising vaccination rates that communities across the country are returning to normal, and shops like yours are back in business. That's important for you, it's important for your clients, it's important for your work family, and it's important for the local economy. That said, it's important to remember, no matter what people are saying, the pandemic is not over. Getting as many people vaccinated as possible means a return to both public health and economic health. Those are things that all of us want. So when you encounter someone who isn't ready to get the shot, follow Mary's advice. Listen without judgment and lead by example. That's the superpower you bring to the fight against COVID-19. You're community leaders. You've built trusting relationships with your guests. That means that you can help them make good decisions about vaccination. Ultimately, as the owner of Tray Shade said much earlier in the program, just do it. Please help us vaccinate America. Check in with Dr. Thomas for more on the Shots at the Shop program. Join our Rally for Recovery initiative at committorecovery.org. But most of all, keep doing what you're doing. I know that for me, being able to go back to the barber and get my hair cut was a really important step forward for our collective recovery from COVID-19. So thank you for the important work you're doing. Thank you for the important role you're playing. We will get through this together. Have a great day.